On the 14th of April 2016, a suspected case from Rukungiri district tested positive for yellow fever, and since then, 7 cases of yellow fever have been confirmed. At least 3 deaths were registered. A total of 60 suspected cases were reported in Masaka, Rukungiri, Kalangala, Bukomansimbi, Kalungu, Rengo, Liantonde, Ntungamo, and Rakai districts. Today, the Assistant Director General of Health Sciences from the Ministry of Health, Professor Anthony Mbonye, said the outbreak has finally been contained. Professor Anthony says Case Clinic, KCCA, Kazuri Clinic in Entebbe, and people can get jabs at the health centers. He urged the public to protect themselves from mosquito bites and report any suspected cases.
To continuously protect themselves from mosquito bites and report any cases with bleeding tendencies and yellowing of eyes, that's jaundice, to the nearest health facility.
When asked about the fact that some of the above-mentioned health centers go ahead to charge the people, yet the Ministry of Health has continued to assert that the vaccine is free, Professor Mbonye replied that it's only the card a person has to acquire on vaccination that is supposed to be charged, but not the vaccines.
The charge of 100,000 KCC poses is definitely it's quite high, but it depends on how they have calculated that cost. It could be a consultancy fee, it could be the cost of the book, it's cost recovery.
On a different note, it has been discovered that worldwide, 2 billion people are exposed to hepatitis B, 350 million have a chronic infection, 65 million in sub-Saharan Africa. Uganda is highly endemic with 10% national prevalence of hepatitis B infection, rates varying across the country from 4% in the southwest and 25% in the northeast. Childhood vaccination was rolled out in 2002, the effect of which on the burden of hepatitis B has not been examined. The prevalence of risk factors for hepatitis B infection is mostly in the north and northeast. Therefore, Professor Mbonye says that the plans to control the spread of hepatitis B are underway.
To control hepatitis B, we have mapped out the areas which are most affected, and we want to begin with the north and the northeast where the prevalence is very high. We have procured vaccines and testing kits at the national medical stores, and these testing kits have been distributed.
Professor Mbonye also made some clarification on the status of medical interns across the country who are currently putting pressure on government, seeking improvement of their terms of work.
Government, Ministry of Finance gives us money to train 350. So if you have, say, 800 or 1,000, that means, first of all, the space, the time, the supervisors. We have decided we are going to give anybody who is going to do internship an exam. We want to find out, like Road Development Center does. Road Development Center, before you go to do to the Road Development Center, they give you an exam. So we are going to give a pre-internship exam. In that way, we shall get people who pass and say, oh, okay, these have passed through the training institutions, this is good quality, they have passed this exam.
Namulindwa for WBS TV.